My philosophy of care is really patient-centered care, and I will say over and over again that I feel very strongly that patients should feel empowered to be the captain of their own ship, and our job is really just to facilitate the journey. And one of the things that I'm very proud of as a physician is there's been this huge culture and paradigm shift from 10, even 20 years ago, when physicians felt very much empowered and entitled to really direct what that end-of-life journey would look like. My philosophy is such that who am I to really paint that picture for you? So as an internist, as a hospice and palliative care doctor, I really do everything that I can to get to know what your individual needs are and how you would like to focus and what you would like to focus on your end-of-life journey. I think one of the things our patients and families can expect at Capital Caring, and part of the reason I'm so very proud to be employed here, is that it's a very individualized, compassionate approach to end of life. We get to know your individual wants and needs as a patient, as a family. What are the hot button topics? What are the issues that provide strain? Help maybe identify some potential blind spots down the road, and really do everything to reassure you that no matter what happens, we're here with you. We work to improve the quality of life by having a transparent conversation. I think as in any relationship, it begins by a place of truth. So I tend to refer to it as courageous conversations. Courageous conversations begin by talking about what you understand to be the current state of your heart disease, how it has impacted your life, and what are some potential concerns you have related to the future and how that may look. What we at Capital Caring take pride in doing is meeting you where you are. If the symptom issue is shortness of breath, fatigue, loss of independence, we are always very clear and honest with you with respect to the symptoms that we can affect change on and which ones are likely to progress. As you know, these are very delicate conversations. They're riddled with emotional issues, concerns, but we do make a commitment to truth and honesty, and we hope to provide reassurance as you continue your journey. So when getting to know our patients and families with end-stage heart disease, the commitment and the communication that we have really from day one is that it is a journey, and each individual end-of-life journey varies from patient to patient. But by getting to know you and getting to know your needs and wants, and what the symptom burden means for you in your day-to-day life, we can actively partner with you so that as the disease progresses, you are more well prepared from an emotional, physical, spiritual perspective about what to expect, and be reassured in the knowledge that we can actually do something to reduce that symptom burden. I find quite often as patients are approaching end of life, whether they have heart disease, cancer, or some other treatment that brings them onto service with us, they want to know that their life had meaning, and they want to focus on quality, not so much time. And so for many of our patients, they want to know that they can live to see another week, 2 weeks to be with their grandchildren, perhaps take another trip, have that opportunity to talk to family members that are perhaps out of town, free, separate and apart from symptoms related to their condition, so that those last moments have moments of meaning and that they're impactful to the ones they love.